Good morning, everyone. Dr. the Honorable Michael Darville, distinguished speakers, distinguished guests, colleagues, ladies, gentlemen, ladies of the media, I warmly welcome you to this morning's session. It's really an immense pleasure to be here today at this important ceremony, marking the certification for the elimination of mother-to-child transmission of HIV in the Bahamas. And on behalf of the Pan American Health Organization and World Health Organization, I welcome you all here today. All the government officials, the healthcare professionals, community leaders, development partners, civil society. And I name you because your presence reflects the shared commitment that made this achievement, this moment, possible. We're also honored to be joined by national leaders and partners who've guided and supported this journey. And your presence here today underscores the importance of collaboration and collective action in advancing public health. Today's gathering, as we've heard, is a celebration, but it's also an opportunity. It's an opportunity to reflect on the work that brought us here, the hard, long work, and to recognize the systems and the partnerships that sustain progress, and to reaffirm our shared responsibility to protect the health of mothers and children. Today, we celebrate lives protected, futures secured, and a nation that has shown what leadership in public health looks like. Let us continue to carry this momentum forward, not only to sustain these gains, but also to advance broader goals in maternal and child health, in HIV prevention, and universal health coverage. Big congratulations to the Bahamas on this remarkable achievement. PAHO WHO remains committed to standing with you as you continue to build a healthier, more equitable future for all. Over the course of this ceremony, we'll hear reflections from leaders and partners, and will formally acknowledge this important public health milestone for the country. We hope this event also serves as a space for connection and renewed commitment as we look to the future. So I invite to join us in recognizing not only this achievement, but also the dedication and the hard work that made it possible, as well as the ongoing work that lies ahead to sustain it. So once again, huge congratulations to the Commonwealth of the Bahamas on this great achievement. And I thank each and every one of you for being here again today. You're very welcome.
Thank you, Dr. Watson. We are so grateful for the continued partnership and support of PAHO WHO in HIV efforts and in so many other health challenges. Now, we will begin remarks with Ms. Kayla Greensmith, who is the Deputy Director of Legal Affairs and co-chair of the National HIV Resource Committee.
Good morning. I recognize the protocol that has been established. On behalf of the Honorable Attorney General Brian Pinder, KC, and on behalf of the HIV/AIDS Resource Committee and all civil society organizations, it is indeed an honor to be a part of this historic accomplishment of the validation of the elimination of mother-to-child transmission of HIV in the Bahamas. This validation reflects the work of dedicated healthcare professionals and a comprehensive and coordinated healthcare system aimed at ensuring that every HIV-positive mother receive the appropriate care and support to eliminate the transmission of HIV to her baby. This comprehensive healthcare system is enhanced by a legal framework that recognizes the fundamental human rights and freedom of all persons in the Bahamas as outlined in our Constitution. It also recognizes laws relating to confidentiality as outlined in the Data Protection, Privacy of Personal Information Act and the medical regulations and anti-discrimination laws as it relates to the employment as outlined in the Employment Act. Further, this validation also reflects the work of civil society organizations who gave critical support to the national program. For example, the AIDS Foundation, who has a long-standing partnership with the national program since its inception in 1992. It is critical to note the work of the foundation in relation to the support given to many HIV-positive young ladies in their outreach program who benefited from the foundation's concerted efforts with the national program and as a result gave birth to HIV-negative babies. Further, the work of the HIV Survivors Benefit of Grand Bahama, who works in partnership with the Grand Bahama Health Services in advancing efforts to eliminate mother-to-child transmission of HIV through education, community outreach, and expanded testing. In these premises, and having attained validation, we commit to remain focused and to continue our work with the national program as we move forward to meet the United Nations goal of ending AIDS in 2030. Thank you.
Thank you, Mrs. Green-Smith. And now we will hear from Dr. Silvana Alighieri, the Director of Communicable Disease Prevention, Control, and Elimination of PAHO and WHO. Now, Dr. Alighieri will join us virtually. We may go to Dr. Alighieri.
Thank you, Mr. Chair. Honorable Dr. Darville, Minister of Health, distinguished party and PAHO colleague, Dr. Boisson and Dr. Joe. Good morning. It's a great honor to join you today at this important recognition and celebration as we mark the validation of the Bahamas elimination of mother-to-child transmission of HIV. On behalf of Pan American Health, I'd like to extend my warmest congratulations to the government and people of the Bahamas, to the Ministry of Health, to the health workers, to civil society, to community partners, and to all those committed and hard work to achievement possible. Today's validation is not the result of a single action, nor a short-term effort. It is the product of many years of leadership, investment, discipline, and partnership. It reflects the convergence of three essential elements. First, it reflects the power of science and public health evidence. We know that without effective intervention, mother-to-child transmission of HIV can occur during pregnancy, delivery, or breastfeeding. We also know that with timely diagnosis, access to treatment, and strong follow-up for both mother and infant, transmission can be reduced to very low levels. Over the years, the evidence base has become stronger, the tools have become better, and the health system have become more capable of delivering effective prevention and care. Second, this achievement reflects political commitments. The Bahamas made the decision years ago that this was a national priority. That commitment was translated into policies, services, and systems. It meant integrating HIV testing and screening into antenatal care, ensuring access to treatment for pregnant women, strengthening maternal and child health services, and sustaining the work over time. Third, and most importantly, this achievement reflects people. This was not the work of one program alone, but a broader national effort involving policymakers, healthcare workers, community actors, and other partners working together toward the common goal. It reflects people who worked across institutions, who reduced barriers, and who ensured that women and infants were not lost along the continuum of care. I also wish to acknowledge the role of equitable access to antenatal care and HIV services free of charge for the users, helped ensure that women did not have to choose between seeking care and meeting other basic needs. That matters. It saves lives. An important contribution to this achievement was the work undertaken to compile, reconcile, and validate data from different services and sources, making it possible to document progress and support this validation process. This ceremony is both a national achievement and a regional one. The Caribbean has demonstrated for years consistent leadership in the elimination agenda. Once again, the region of the Caribbean shows that ambitious public health goals can be achieved when technical excellence is matched by political will and community engagement. But at the same time, validation is not the end of the road. It's a major milestone that needs to be protected and further expanded. This means maintaining high-quality maternal and child health services, preserving timely HIV testing and treatment, and continuing to monitor results with rigor while addressing the challenges that remain ahead. Particularly, the need to advance toward the elimination of congenital syphilis and to contribute to a broader goal of ending HIV as a public health problem. It also reminds us of a broader opportunity. The experience of EMTCT shows us that it's possible when countries organize around clear targets, integrated services, and accountability for results. This is fully aligned with the PAO and regional initiative for accelerating the elimination of more than 30 communicable diseases by 2030. The lesson is clear. When countries build integrated, people-centered system, elimination becomes achievable. So today we celebrate an achievement that will protect future generations. We celebrate a public health success built through persistence and partnership. And we celebrate the Commonwealth of the Bahamas, which now joins 12 other countries and territories in the Americas in demonstrating that elimination is not just an aspiration, but a measurable and attainable reality. PAO is honored to have walked this path with you, and we remain committed to supporting the Commonwealth of the Bahamas and all member states as they work to sustain these gains and advance toward broader elimination goals. Congratulations once again, and thank you.
EMTCT. This is no slight achievement, it is a major achievement. And now you will see a video of the Bahamas experience. If we need to come back to the video, no, it's coming now. Okay.
very hard to address the situation of HIV/AIDS in the Commonwealth of the Bahamas.
So we are very aggressive with when it comes to pregnancy. The first thing that we do is that we encourage moms to have early bookings within the first trimester to enter the clinic. Once moms arrive at the clinic, we aim to do all of their needed that in the first visit.
Usually when the patients come, so usually we give the investigations and everything on the first visit. So we follow all the labs and everything immediately, depending upon the results. So we immediately implement the treatment.
So in the Bahamas, all women seeking and accessing antenatal care services from the public sector have access at no cost to them.
I would note also that to say that events are completely free, as is testing, as is actually care.
The Pan American Health Organization, PAH, congratulates the government and people of the Bahamas on achieving the elimination of mother-to-child transmission of HIV.
A lot of people have been involved.
Now we will have several video presentations today. The next one will come from Ms. Anurita Baines, the Associate Director of HIV/AIDS, UNICEF. We pointed out that this whole process began in 1991, and the Bahamas, along with other governments in the region, in September 2010, formally endorsed the PAHO and UNICEF Elimination of Mother-to-Child Transmission of HIV and Congenital Syphilis Initiative at the 50th Directing Council meeting of PAHO member countries. And now, if we can hear from Ms. Anurita Baines, the Associate Director of HIV.
Distinguished guests, colleagues, and friends, it is my great honor to join you today. My name is Anurita Baines. I'm the UNICEF Global Associate Director for HIV/AIDS, and I bring warm greetings on behalf of UNICEF. Today we gather to celebrate an extraordinary achievement. With deep admiration, we extend our heartfelt congratulations to both the governments of Bahamas and the Turks and Caicos Islands for their remarkable success, the elimination of vertical transmission of HIV in the Bahamas, and the elimination of vertical transmission of HIV and hepatitis B in the Turks and Caicos Islands. This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2050. Your achievement reflects what is possible when health systems are strengthened, when communities are engaged, and when every pregnant woman is supported with testing, treatment, and care. It ensures that newborns begin life HIV-free with the promise for a healthier future. Latin America and the Caribbean has long been a beacon of progress in this global effort. From Cuba, the first country in the world to be certified, to Brazil's certification last year, and now to the Bahamas and the Turks and Caicos Islands. The region continues to lead with ambition and determination. Today, more than half of all countries and territories that have achieved that inspires the world. And at a time when global health faces competing priorities, constrained resources, and growing complacency, your success stands as a powerful reminder. Ending AIDS among children is not only possible, it is healthcare workers, community leaders, government officials, partners, donors, and the UN family. Please accept our warmest congratulations. UNICEF is proud to stand with you, proud to learn from you, and proud to continue the journey with you. Together, we move closer to realizing a region and a world where no child is born with HIV, syphilis, or hepatitis C. Together, we can build a future where every child thrives. I thank you.
Ms. Anna-Rita Baines, the Associate Director of HIV/AIDS at UNICEF. Now, you will note that we have several video pre-recorded presentations, and we're also streaming live. So we beg your patience as there may be some delays from time to time and some slight interruptions. Now, our next presenter is from UNAIDS, Ms. Luisa Cabal, the Regional Director of UNAIDS, who has given us a pre-recorded presentation.
The Pan American Health Organization.
Dear colleagues, friends, and partners across the Caribbean, on behalf of the entire UNAIDS team and our Executive Director, Winnie Yanima, I want to congratulate the Bahamas on eliminating mother-to-child transmission of HIV. This certification comes at a critical moment as the world works to end AIDS as a public health threat. The Bahamas is showing that eliminating mother-to-child transmission of HIV is possible. When women can test early in pregnancy, start treatment quickly, and stay in care, more babies can be born free of HIV. This achievement reflects strong political will and steady investment in primary health care. It also recognizes the dedication of health teams and of people living with and most affected by HIV who work every day to ensure babies are born free of preventable infections. Thank you all for this incredible work. I also want to thank PAHO for its leadership in advancing the regional elimination agenda and for supporting countries through its elimination platform. UNAIDS is a proud partner of this platform, and we look forward to continuing this collaboration with PAHO and all partners towards more certifications like this across our region. We encourage the government of the Bahamas to sustain investments and protect this hard-won gain. In practical terms, this means strengthening integrated maternal, newborn, and child health services, ensuring reliable access to quality-assured medicines, diagnostics, and supplies, taking action to end stigma and discrimination, and supporting community-led responses that help women and families stay connected to care. I send you my warmest regards from PAHO.
Thank you, Mr. Cabal, the Regional Director of UNAIDS. Now, as we move on that timeline of how this journey advanced, the Bahamas and Haiti in the 1990s were selected as pilot countries that will pilot prevention of mother-to-child transmission, EMTCT. Dr. Perry Gomez, as was the first director of the National AIDS Program of the Bahamas, took the first EMTCT medication to Belize to assist Belize with their PMTCT program. We now go to a virtual presentation live with Ms. Wendy Telt Emanuelson, the Executive Director of PAMCAP.
Thank you. Okay. Online we are hearing some feedback. I think it's better now. Thank you. I recognize the established protocol, and it's my privilege to join you today in celebrating a remarkable milestone for the Bahamas and for the Caribbean. On behalf of the Pan-Caribbean Partnership Against HIV and AIDS, I extend sincere congratulations to the government and people of the Bahamas on being certified by the WHO for achieving the elimination of mother-to-child transmission of HIV. This achievement reflects strong leadership, committed healthcare workers, dedicated partners, and families who trusted the health system. It shows that with vision, coordination, and sustained effort, progress is possible. Today, the Bahamas strengthens the Caribbean's proud legacy of leadership in the elimination agenda. I wish to offer special recognition to Dr. Nakia Forbes, Director of the National HIV/AIDS and Infectious Disease Program at the Bahamas Ministry of Health, and also the Chair of the PANCAP Advisory Coordinating Committee, one of the key governance arms of PANCAP. Dr. Forbes, we thank you for your excellent leadership nationally and regionally. I also recognize Ms. Sandra Jones, advisor at the PAHO WHO Caribbean Office, for her dedicated technical support to countries across the region. Your contribution has been invaluable. We also thank PAHO, WHO, UNICEF, and UNAIDS for its continued leadership and partnership in helping countries achieve and sustain these important milestones. At PANCAP, we remain committed to working with the Bahamas and all member states as we pursue our shared goal of ending AIDS as a public health threat by 2030. Congrats once again to the Bahamas. May this success inspire the entire Caribbean to keep moving forward. I thank you.
Getting people to understand and be more aware. Today, we have a recitation of a poem by a health professional, Ms. Teasel Lightburn.
Good morning. The title of the poem is called Change. To the ones we lost along the way, if only the world would change and see things through your eyes, to see that it wasn't your fault, to see that you needed to be encouraged when you needed to be loved. You needed someone to wipe your tears. You only wanted to be loved by the people you loved the most. You only wanted grace. If the world would change, you could speak your truth, live your life from ridicule and shame, pain and guilt. If the world would change, you could help others like you, walk down the streets, sit in a classroom, hang out with your friends that knew your status and still loved you. The same, oh Lord. If the world would change, you would be here with us, living, loving, and laughing without shame. If only the world would change. I am only one in 1,000, but I see your heart and understand from where I stand. The world didn't have to change because you were my world, and I would have held your hands forever. The world didn't change, but my world was shattered, heartbroken. A smile that is only a memory, love that hurts, tears that fall, sleepless nights and tearful days, broken families, silence that fills the home. Thoughts of getting through the holidays without you. If the world would change and see you through your own eyes, if only the world would change. Thank you.
Thank you, Ms. Lightburn. Now, you may have noticed that we had just a slight technical glitch while presenting a video of the Bahamas experience to you. We've corrected that, and now we present it to you again.
Bahamas have been working very hard to address the situation of HIV/AIDS in the Commonwealth of the Bahamas.
So we are very aggressive with moms during pregnancy. The first thing that we do is actually encourage moms to have early bookings within the first trimester to enter the clinic. Once moms arrive at the clinic, we aim to do all of their native labs at the first visit.
Usually when the patient comes, usually we give the investigations and everything on the first visit. So we follow all the labs and everything immediately depending upon the results. So we immediately implement the treatment.
So in the Bahamas, all women seeking and accessing antenatal care services from the public sector have access at no cost to them.
Of note, also I would like to say that this completely free, as is the testing, as is antenatal care.
The Pan American Health Organization congratulates the government and people of the Bahamas on achieving the elimination of mother-to-child transmission of HIV.
A lot of people have been involved in us achieving this great milestone. Our nurses and our public health system, all of our nurses and doctors in our tertiary healthcare system, and by extension, all of the clinics that spread throughout our archipelago. The issue of reporting has always been a challenge, and with the implementation of new IT systems, we are now in a position where this is becoming a reality for us. And Tahoe, WHO, and the entire team from abroad has been working very closely with us in order for us to accomplish this wonderful milestone.
Bahamas has a very robust and good antenatal program, and the health programs are good, including infectious diseases clinic and the HIV clinic. And I think the services are excellent. What we need to strengthen is documentation. And so one of the main solutions that we came to were to host a training with a lot of the midwives and nurses at the clinics.
We have a training as part. In order for us to maintain this recognition, requires massive training throughout the country, particularly in our public healthcare systems and our primary healthcare clinics. It's important for us to have the necessary medication training as well as digital platforms for monitoring and documenting.
Now we have the capacity within the country, we have the level of partnership and camaraderie among stakeholders to work together to provide the evidence and to put in the steps that are necessary to develop grants and to sustain elimination of other agents on the elimination agenda.
I'm proud of Bahamian. And historically, the Bahamas was the first English-speaking Caribbean country to have PETCT program. My predecessor, Dr. Gomez, who's passed away sadly, he started that program and he shared the knowledge of other Caribbean countries. And so we have read that every day in the Bahamas. We'll be smiling from ear to ear. We'll be very proud.
We celebrate because we realize that it will put us back on the map because we were pioneers in the fight against HIV, and so it will be a moment of great enjoyment and celebration for us.
We have started this work for a very long time. We are very comfortable with all of our patients coming through our doors, whether they are HIV positive or not. And so the validation will just tell us that we can continue doing the good work that we have started.
This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2030.
This achievement reflects strong political will and steady investment in primary health care. It also recognizes the dedication of health teams and of people living with and most affected by HIV who work every day to ensure babies are born free of preventable infections.
As we look ahead, this milestone is not only a moment of national pride, but also an opportunity to build on this success. It should inspire continued progress toward eliminating mother-to-child transmission of syphilis and hepatitis B.
Bahamas, these women, men and women who work for the National HIV/AIDS program, they've done this for decades, and I think it's high time that, they got that recognition for what they do, the lives that they've saved every day, and I personally appreciate what they have done, what we have all done working together, and I'm excited to see that played out in the success of the validation.
The Bahamas journey to In February of 2016, the first meeting of the National Validation Committee on the Elimination of Mother-to-Child Transmission took place. It was chaired by Dr. Nakia Forbes and Maisie Evans, who was Undersecretary. At the time, Dr. Perry Gomez was Minister of Health, and he attended and brought remarks. Chief Medical Officer, Dr. Ben Benaby attended, as well as Acting PAHO Representative, Dr. Catherine Israel. We now go to congratulatory messages. The first one is a virtual one, and it is by Dr. Jody Dion, the chair of the Regional Validation Committee, who joins us, as I said, virtually.
Good morning to you all. On behalf of the Regional Validation Committee, I am so honored to be here to speak with you and extend our congratulations to the Bahamas. For those of you who aren't familiar with the process, we reviewed all the data from 2022 through 2024 to make sure that all the benchmarks were met. We had an in-country visit at the end of October to look at program services, data verification, laboratory testing, and maybe most importantly, to speak to users of the services, women who are pregnant now or were recently pregnant, to see how it was working for them. We saw very strong programs across the board. We congratulate you all on the hard work that you have done over the years to make this commitment happen. We know that the Bahamas will be an example for others in the region to follow, and we extend our sincere congratulations to you all for the effort. I might be biased, but I think there's no more important work being done in the world today than the type of work you are doing in the Bahamas to reach these goals and to support the teams that are doing it. Thank you.
Regional Validation Committee, thank you. We now have a pre-recorded video from the Director of PAHO, Dr. Shabazz Babusa.
The Pan American Health Organization PAHO congratulates the government and people of the Bahamas on achieving the elimination of mother-to-child transmission of HIV. Under the leadership of the Minister of Health and Wellness, my dear friend Minister W, mothers and babies have benefited from evidence-based prevention, timely treatment, and respectful person-centered care. This has led to the remarkable success celebrated today. This achievement reflects sustained political commitment and strong national leadership, alongside the dedication and compassion of the health workforce, nurses, doctors, public health professionals, who have worked tirelessly to ensure high-quality services that are accessible to all pregnant women, their partners, and exposed infants, regardless of nationality. It also highlights the power of collaboration across public and private health sectors, civil society organizations, and key national partners, working together under the leadership of the Ministry of Health and Wellness. As we look ahead, this milestone is not only a moment of national pride, but also an opportunity to build on this success. It should inspire continued progress toward eliminating mother-to-child transmission of syphilis and hepatitis B, and advancing efforts to end HIV and other communicable and neglected diseases as public health threats across the Caribbean and the Americas. Once again, congratulations to the Ministry of Health and Wellness on this extraordinary achievement. I reaffirm its continued support to the government and people of the Bahamas as we advance toward a generation born free, not only of HIV, but also of syphilis and hepatitis B. Thank you.
And now for the presentation of the certificate, I should like to invite Dr. Eldona Boisson, the WHO representative, and Dr. Michael Dowell, the Minister of Health and Wellness, who will accept it and give remarks after that. Thank you so much. Thank you so much to our Master of Ceremonies, Mr. Julian Reilly. I've been around for a while. As a young doctor, I had the opportunity to work very closely with Dr. Perry Gomez in the early days of HIV. And a lot of uncertainty was taking place in the Commonwealth of the Bahamas. On becoming the Minister of Health, and as I traveled to many international conferences throughout the world, and realized the Bahamas was still on the list of mother-to-child transmission, we made a commitment in 2021 that we would do all in our power to accomplish this great milestone for one of the greatest pioneers in the fight against HIV in our region. Now, I know Julian said a moment of silence, but this is such an important milestone that I want everyone who can stand to stand up. For our brother friend, Dr. Perry Gomez, who was in the fight, sacrificed a lot, became the Minister of Health, did his best to bring this to a reality And today we celebrate this great milestone on behalf of a great physician, a dedicated Bahamian, and a friend and mentor. Give it up for Perry Gomez. Thank you so much. I too would like to adapt the established protocol and recognize the hundreds of individuals who are joining us virtually in celebration of what we have accomplished as a country when we put our heads together and healthcare professionals throughout our archipelago began to put these protocols in place, and for us to ensure that we have the means and mechanisms in the country to monitor and document the great work that we have been doing. But today I'm delighted to join you at the beautiful Warwick Hotel on Paradise Island, Bahamas, as we celebrate with pride a national achievement that speaks to both the strength of our healthcare system and to the lives it protects. The certification of the Commonwealth of the Bahamas for the elimination of mother-to-child transmission for HIV means that babies in this country are now being born free of HIV, and mothers are achieving the care and treatment they need to live healthy lives. This outcome is a result of a deliberate and disciplined public health strategy. It reflects strong antenatal care coverage, routine testing, early and sustained treatment, and consistent follow-up throughout our islands. It also reflects the strength of our systems to track, monitor, it shows our system in the common. I like the role of front lines as this success has delivered to routine care done well every day across our country. From our related clinics to community health centers, national laboratories, the outcome discipline, effectively done by our healthcare workers and by extension. I wish to commend the healthcare team across the Department of Public Health and the Public Hospitals Authority to the private sector for their high standards of care. We also recognize the importance of surveillance from our system. This certification provides not only quality clinical services, but also the ability to monitor the phone and verify results. Capacity to remain clinical as we maintain this high level of standard for so public. This certification is not a one-time accomplishment. It is a standard that must be maintained. Please, reliable access to diagnostics, supply chain, also required maintain focus on reaching those difficulties.
extend gratitude and HIV/AIDS Dr. Beautiful. For your ability and your commitment to respond. Like Perry Gomez, I know he would be proud. And as my man, proud. Also acknowledge the partnership with the Pan American Health Organization, the World Health Organization, by for one it's a moment of also responsibility. We must protect, continue to strengthen our systems and apply these lessons to other priority areas, including common diseases and any emerging health threat. This problem is certified and important. Gentlemen, our Prime Minister support the initiatives of public health. It's not here this morning because of circumstances beyond control. Concerns its warmest regards and congratulate the entire team for this great accomplishment in public health. We also wish to thank all of our international partners for their support and look for ongoing support in the future. And now ask the PR team to please play his pre-recorded recordings.
Ladies and gentlemen, today we gather to celebrate a truly defining achievement in the life of our nation. The certification of the Bahamas for the elimination of mother-to-child transmission of HIV. This milestone reflects a clear national commitment to protecting the health of mothers and children. Every child deserves a healthy start in life. Every mother deserves the care, dignity, and support to give that child the best possible future. It also speaks to a health system that is organized, responsive, and capable of delivering results that improve lives across generations. As we celebrate our achievements, we pause to honor those who laid the foundation for this success. In particular, I wish to recognize the enduring contributions of the late Dr. Michael Perry Gomez, whose visionary leadership and steadfast commitment to the national HIV response helped to chart the course we celebrate today. His work reminds us that progress in public health is never accidental. It is built through courage, persistence, and a deep sense of duty. Ladies and gentlemen, this achievement stands as a powerful example of what is possible when healthcare is placed at the center of national development. As a government, we reaffirm that healthcare is not a privilege, it is a right. It is the core pillar of our national agenda, and we remain committed to ensuring that all people in the Commonwealth of Bahamas, regardless of circumstance, have access to high quality, equitable care. Our focus on protecting the most vulnerable, our mothers, our children, our families, has been central to this success. The certification reflects years of deliberate investment in strengthening our public health infrastructure, expanding access to antenatal care, and ensuring early diagnosis and treatment. This administration's planned investment in clinics, in hospitals, and upgrades to existing facilities will further contribute to our ability to secure positive health outcomes for our people. I wish to commend the extraordinary professionals who made this possible. Our doctors, nurses, midwives, laboratory teams, public health practitioners, and the dedicated staff, the Ministry of Health and Wellness, and the Public Hospitals Authority. Their work is often done quietly, but its impact is immeasurable. It reminds us that healthcare is humanity in action. Through your hands, lives are saved, Jesus is secured, and hope is restored. We also recognize our local, regional, and international partners, whose collaboration has strengthened our efforts and ensured that the Bahamas meets and exceeds global standards. Ladies and gentlemen, while we celebrate today, we must look ahead. The certification is not the end of the journey. It is a goal to sustain and build upon our progress. We must continue to close gaps, reach those underserved, and ensure that no mother, no child, and no family is left behind. Let this moment inspire us to press forward with even greater determination toward a healthier, more resilient Bahamas. And let us commit to safeguarding the health and future of generations to come. May God bless you all, and may God continue to bless our Commonwealth for the Bahamas. Thank you.
Very well. Words. Thank you. What's that? The very talented boy. Very well. Didn't see him. We would see Nurse Rosemary, and my name is not here. Nurse Rosemary Bailey is, I mean, Thank you.
Good day, all. Flying from ear to ear on this momentous occasion. So I stand on the established protocol, esteemed colleagues, partners, and guests, ladies and gentlemen. As we end this historic close, I am honored to speak in my capacity as chair of the National Validation Committee and director of the National Infectious Diseases Program. Today is not only a celebration of achievement, it is a celebration of effort, sustained commitment, and national resolve. The certification of the Bahamas for the elimination of mother-to-child transmission of HIV belongs to all of us. This achievement reflects the Bahamas meeting all global EMTCT validation targets, including a mother-to-child transmission rate of HIV that was less than or equal to 2%, a perinatal HIV incidence below 0.3 thousand live births, and over 95% coverage in antenatal care, HIV testing, and treatment. These results are confirmed. Through a rigorous process of data verification, stakeholder interviews, and both virtual and in-country assessments. Following the October 2025 validation mission and subsequent review by regional and global validation committees, the World Health Organization has certified the Bahamas for EMTCT of HIV. Today, mother-to-child transmission is extremely low. Transmission is not zero, but low enough to be considered below a significant serious public health concern. Importantly, over the review period, only 2 babies were born with HIV out of nearly 10,000 live births. This is a powerful testament to the strength of our comprehensive EMTCT program, its services, systems, and the support provided to mothers and families. In some years, there have been no babies born with HIV, and overall, the transmission remains low. This success reflects strong national systems across prevention, clinical care, diagnostics, surveillance, and an enabling environment grounded in equity and access. On behalf of the National Validation Committee, I would like to give thanks. First, I give thanks to Almighty God for guiding us to this moment. I extend sincere appreciation for our national leadership, the Prime Minister of the Commonwealth of the Bahamas, the Minister of Health and Wellness, and the Permanent Secretary for their steadfast support and commitment to this journey and our health programs and policies. We gratefully acknowledge our technical partners, the Pan American Health Organization and the World Health Organization, especially Dr. Aldana Guesson, our PWR, and Sandra Jones of Tahoe for her exceptional guidance and support. Sandra. To our international and regional partners, including United Nations agencies, Ms. Andrea Baines, Ms. Wendy Telk-Manuson of PANCAP, Dr. Jody Dion, Dr. Sylvain Aldegeri, Dr. Barbosa, and Ms. Louisa Cabal, thank you very much for your leadership and commitment to fostering a generation free of childhood infections and your congratulatory remarks. To our healthcare professionals across the country, within the Public Hospital Authority, the Department of Public Health, and across both public and private sectors, doctors, nurses, midwives, laboratory professionals, public health officers, and administrators, your dedication has made this achievement possible. We acknowledge the Ministry of Health and Wellness teams, the infectious diseases program teams, our communications team, and our national and community partners, as well as our data and surveillance professionals, for whose rigor and commitment underpin the certification. We also extend sincere thanks to our civil society partners and partners across all sectors, and this includes some sectors like the Gender and Family Affairs, the Attorney General Office, Social Services, Education, and other key agencies represented on the National Validation Committee. Your contributions to human rights, legal protections, and social support systems have been essential to creating the enabling environment for this success. I extend special appreciation to the members of the National Validation Committee, past and present, for your diligence, expertise, and unwavering pursuit of excellence. We recognize in today's program Sister Clara Roll, Mr. Julian Reed, Ms. Kayla Green-Smith, and Mr. Sal Lightborn. And thank you very much for online participants and to the Royal Bahamas Police Force Pop Band for your contributions to today's ceremony. To the staff of the Warwick, we appreciate your support and hospitality, and we honor those, lastly, we honor those whose leadership laid the foundation for this achievement, including Dr. Michael Perry Gomez. So as we close, we do so with pride, but also, this certification is not an endpoint, it's a responsibility. A responsibility to sustain these gains and ensure that what we have achieved is protected for future generations. We must continue to maintain the elimination of HIV mother-to-child transmission while strengthening our systems to achieve and validate the elimination of syphilis and hepatitis B. We must remain vigilant, ensuring early antenatal care, universal testing, timely treatment, and no missed opportunity, so that the reality we celebrate today becomes permanently secured. Today we move forward, committed to protecting every mother, every child, and building a healthy Bahamas. I thank you all, and have a wonderful week.
Hello. And we began our program. The other day, so we did a photo of the session taken by council. I believe, Mr. Hardy, organizing the. Okay, great. So, you want to come to the. Dr. Basson and Dr. Dallo and Dr. Forbes. And really, I guess, then there's everyone who's in the office. I know what it was. University Regents. He was the first regional chair of the Validation Committee. So again, I want to go.